Hi, going live today talking about gut health with Dr. Kelly Livingston. We're going to talk about gut infections and how to diagnose and treat naturopathically. We'll also be talking about any other gut health problems that you want to talk about, including acid reflux and bloating and whatever questions come up today. We would love to have a conversation about gut health. It's such a big and I think something that a lot of people deal with on a daily basis. And I think a lot of us just live with these gut health
Hi.
problems. And hi, I was just saying, I think a lot of people live with gut health problems and, either find it to be just normal for them now, or it's something that really bothers you on a daily basis. So we'd love to
Great.
chat about it. And how are you doing, Dr. Livingston? I see you're outside. I was going
I'm
to go
good.
outside, but
Yeah,
I
I
didn't
just
know if
want to
I
make
could.
sure that you can hear me. Normally I'm in my office, but today I'm out in my backyard. I'm about to go pick up my daughter when we're done. So I just want to make sure that you guys can all hear. Is that
Yeah, your
works?
sound is
Awesome.
great. Yeah, I was going
Yeah,
to go
you're
outside, but I wasn't sure if I could control the sound as much. So, but you sound great.
yeah. You're
So
very accurate. So either it's something that bothers my patients on a daily basis and it's really detrimental to their daily lives, or it's something that they don't really realize is a problem. And oftentimes our gut instinct, it tells us what's going on in the rest of our body. And so sometimes that's the first sign that there's a chronic health issue that should be addressed.
right, right. And I think I wanted to start with why people have so many gut problems. I have some theories as to why that's the case. And in my opinion, it starts all the way at birth.
Mm-hmm.
So what are your ideas in terms of why gut issues are such a big problem in our world today? And I'll chime in too.
Yeah, I agree. I think it does start at birth. One of the first things that I ask people is when they come in with a kid or when they come in for their own health issues is, was it a vaginal birth or not? And nothing against having to have a C-section, but oftentimes there is antibiotic usage that goes along with that. And also, if they were, strep positive, they maybe had antibiotic usage during pregnancy, and therefore the flora in the vagina, which is the same as the gut, or not the same, but it's also populated, will be a little bit different and maybe need some supplementation or some addressing that root cause of it being imbalanced. And then I think we're just exposed to so many things that kill our gut flora on a daily basis, whether it be food or water. Everything and anything kind of is putting us at an imbalance. I often tell my patients it's a bit of it's like a seesaw. So you have your good gut bacteria and you have your bad bacteria, and you want the good guys there, right? They provide immune support and they make neurotransmitters, but you also don't want the bad guys overgrowing. And so we're exposed to things that kind of are on the side of the bad guys on a daily basis. So we have to really be cognizant of that fact and work on it. So yeah, I think it starts from the day we're born.
Yeah. Well, so I think you're right. I think about the strep B and how a lot of women have to take antibiotics. I also think C-sections, when the baby's not going through the birth canal, the baby is not, intaking all those microbes that are actually the baby's supposed to as the baby's going through the birth canal. And
Yeah.
so the baby's microbiome may not be as populated. I also think that breastfeeding. So those are the questions I always ask. Were
Yeah.
you vaginal or C-section? Were you breastfed? All of those things play a role in how your gut's going to be populated as a baby. And then how our food is introduced, I think, is also a big thing too. And if our children are eating a lot of sugar, that's going to populate, a
That
lot of
feeds the bad guy.
yes, it's going to feed the bad guys, and things that are really high fiber and kind of like prebiotics are going to feed those good guys. So I think starting all the way back to childhood, all the way back to pregnancy, and that's where you want to think about your gut health and where it begins. And then as we age, we have problems with taking antibiotics and eating too much sugar and literally eating just crap food, the standard
Yeah.
American diet. which is now feeding all these bad bugs
And
and
taking antacids.
taking antacids, which is really, really bad, right? Because then now we're not going to be digesting our food the way we need to be digesting it, etc. And then I did a post about eating sushi and being exposed to parasites and undercooking our meats and things like that. And so there's so many reasons that gut health is a problem. And now as you kind of see all these reasons, you can see why so many people have gut health issues. Because there's so many ways for our gut health to really be in balance. And the standard American diet, if you just took out everything else we said, the standard American diet by itself is just going to mess up your gut. I mean, you know, in general. So yeah. So there's a lot of things to think about. And then on top of that, there are food intolerances and food allergies, which some of those could be true allergies, but some of those could actually just be due to something called leaky gut, where you're just getting a lot of food intolerances because there's been so much inflammation in your gut for so long and your microbiome is so off. And so as you can see, it becomes a perfect storm of things that have happened that lead you to now having bloating every day, acid reflux, constipation.
I feel like we could do
diarrhea.
so many posts. We could do so many posts on this.
I mean, there's so many topics here, and I'd love to hear from you guys who are on the live and any questions you have, any specifics that you want us to get into, because I wanted to talk about like why is this a problem? Because I think when you understand why it's a problem, there are things you can start to fix, you know, in terms of eating too much sugar in your diet and you know, eating prebiotic type foods and then probiotic type foods, which actually we should go over. So what are those prebiotic and probiotic foods that you would suggest, Dr. Livingston?
Yeah, so it kind of ties back into a test that you and I both run, or a form of it, where we look at short chain fatty acids and we look at the ability of the gut to actually digest foods and how much you're actually getting the fuel for the gut cells. So butyrates and things like that. So for me, I always tell patients, number one, you know, eat real food, eat plants. Number two, be aware of the fiber content. So like, for example, an apple has both soluble and insoluble fibers. Most people aren't aware that those are a different thing. So soluble means they're going to absorb water. They're going to take on water and they're going to kind of move stool through, where insoluble is kind of like more roughage. It's kind of like a cleansing agent for the stool. Having things like kimchi in the diet, fermented foods, having flaxseed, psyllium, these tiny changes not only help your gut health, but they also help things like cardiovascular health. Like your food is your medicine. So the more plants you eat, the better you are.
Right. And more whole foods, not just plants, but whole foods. So, I mean, I think you could break it down from eating like so much processed food. And I even think like vegetarians and vegans end up eating a lot of not whole foods, like they'll eat, you know, things that are prepackaged and like cheeses that are now totally processed, and all of those things are not great too. So I think whole food is important. I think a lot of plants is very important as well too. And I think making sure if you're eating like meat and things like that, that it's cooked and that you're making sure that you're protecting yourself.
You know where you're getting it from.
You know where you're getting it from. And raw fish definitely can have parasites and little larvae that we can't even see. And then you're eating it and ingesting it. And then now if your microbiome is not healthy, that's going to leave you susceptible. Now, with a stronger microbiome, which Dr. Livingston was talking about, like good bugs, bad bugs, your good bugs are going to wage like a little, they're like a little army.
I know. I always say they're an army too.
They're going to wage a war. And so that's what you want. You really want to build up that army with all those prebiotic foods Dr. Livingston was talking about, and probiotic foods you were talking about, like the kimchi, yogurts and things like that. So I think that's a way for your gut health to really help proliferate the microbiome. Not taking antibiotics. So as naturopathic doctors, we have tools for almost everything that you would use an antibiotic for. So a UTI, etc. We have tools for that.
That's a big one in women's health. We should probably do a live on that. And there's so many things that you can do outside of antibiotic usage.
Right, right. And so I think before jumping to an antibiotic, seeing with your naturopathic doctor if you can handle it before then. So with my patients, I usually say, all right, let's try to boost your immune system for 3 days. If you still have the problem after 3 days, then we'll prescribe you an antibiotic. My patients never have to take antibiotics. You know, if they come to me, we pretty much boost the immune system. And if you boost the immune system, you can avoid taking those antibiotics. Now, those antibiotics are necessary sometimes when it's gone too far and the immune system maybe isn't strong enough to fight it, but the hope is that we boost your immune system to fight it. So not taking antibiotics. And then our food, I mean, GMO foods and, you know, things like gluten and dairy can cause a lot of inflammation and toxicity in the gut, and really also feed the bad bugs, and also imbalance the microbiome as well too. So those are all things I think we can do in our daily life to just improve our gut health.
Mm-hmm. And I really liked your post about the parasites and being cognizant of the fact that, you know, fish and meats and things have parasites. We had a mentor, I won't name him just because, but he would say, if you have a pulse, then you have a parasite. And I'm often telling patients, you are encountering them on a daily basis. And as you said, when your terrain and your gut microbiome aren't balanced out, they can take hold and they can wreak havoc and they can show signs and symptoms at that stage. But oftentimes they're not even showing a sign or a symptom of their presence.
Yes.
And so, we're kind of battling that on a daily basis and we don't even know about it. So that's really why
that's one of the problems. I think that the parasites can really go unnoticed. That you might have a little bit of bloating, you might get some headaches, you might have a little like eczema. And I'm finding parasites in people who I did not even think they had parasites because they don't have those outward, you know, like they're losing
or autoimmune conditions because the parasite is triggering the immune system.
Definitely all these microbes can stimulate autoimmune conditions to occur. You know, because of mimicry and the antibodies are being created to now these bugs. And then now the body's getting confused and creating these antibodies to our own body. And that creates autoimmune disease. So I find parasites in people that have no symptoms of parasite infection.
That's a question that I get all the time. And that also goes along with food sensitivity. So I'll get people saying, you know, how do I have this parasite or how do I have this food sensitivity or allergy and I have no diarrhea or constipation? And I have to explain to them, well, your body is manifesting symptoms in a much different way. It doesn't always have to be gastrointestinal. So
exactly. Yeah. And I think almost any symptom, that's why as naturopaths, we literally rule out everything. We check your gut, we check your food intolerances, we check all of it because it could be playing a role and not giving you the symptoms that you're supposed to be having, right? And so the reason I actually did that post, because I had a couple of patients who have shown me worms in their stool lately. And a bunch of those patients love sushi. And so I actually said, you know what, I should probably do a post about this. And I think a lot of people don't know about, you know, there potentially being parasites in their sushi. You know, if you prepare it yourself and you do all the things you're supposed to do, like freeze it at the right temperature or cook it, then those parasites can be killed. But the thing is that our home refrigerators do not freeze the fish to the level they need to be frozen to. So in general, I think you should be cooking your fish all the way through because that will kill the parasite. So, you know, that's just something to think about.
Sushi is so good though.
I know, it's so good. And actually I've been like not eating it as I used to eat sushi if it was at a really good restaurant, but I still don't think necessarily that they would possibly handle it the correct way. It might be sitting out there for a long time. And parasites are not the only thing to think about in the sushi and other foods, but the bacteria and other things too. So let's say in a sushi restaurant, it's been sitting out for a long time. So that will now grow, you know, bacteria and other things. So I did another post about smelling the fish. And so even if you still are going to eat sushi, just smell your fish. And if it smells fishy, then it's probably gone bad. Yeah, exactly. It's gone bad. And so that's just one thing to consider. And I mean, the thing is if you do eat meat, Fish is such a good, nutritious source of omega-3s and
Yeah.
protein. And I mean, it really is a really good source. The unfortunate thing is not only the bacteria and the parasites, but also the heavy metals, which we talked about last week, and other things that are accumulating in the fish. But yeah, so I think there's a number of things to think about within the diet and things you can start paying attention to on a daily basis to make sure that your gut health is going well.
Yeah, and also promoting the gut health in general to combat that little seesaw. You know, then you feel a little bit better when you do have your night out and have your sushi. You know, you've populated your good bacteria and they can kind of fight against the bad guys.
Yeah, yeah. And I think that's true of our immune systems in general. You know, you have a strong immune system, it should protect you against, you should have that army just ready. And when you're exposed to anything like a virus or a parasite or whatnot, that your body's able to fight it. And I think that's what's important. So really maintaining a good lifestyle is important. Now, let's say that you have some of these symptoms. Okay, so what do you do? So, well, first of all, I would say all of these.
Ooh, I like this part.
Yeah, diet related things is one, right? You should start doing those things now. Take those anti-inflammatory foods out. Take that sugar out of the diet. Eat your, your prebiotic and probiotic rich foods that we talked about earlier. And then I think it's important to see a naturopath and get assessed, because there are some ways that we assess your gut health that's just different. Typically when you go to a gastroenterologist, they're running like a parasite test, and they're running maybe like
they're doing an O&P, and that's about it. Yeah.
They're doing like they're checking for C. diff, they're checking for H. pylori. They're only checking for the bad bugs. Okay. And when we run labs for gut health, there's a number of things we look at. For me, I'm looking at good bugs and bad bugs, right? So I want to know, how good is your army? Do you have a strong army that's backing up your gut health and your immune system? And then I posted it on my last post, one of the tests I like to use, but it also checks for inflammation and digestion. It checks for the immune system of your gut, which I actually think is one of the most important tests I do. I find the secretory IgA number.
Oh my gosh, that's one of my favorites.
It's my favorite test, because when I find that, I know, okay, the immune system's not working the way it needs to. There's burden on your immune system of your gut.
Or also it's turned on at a high level.
Or it's turned on, But more often than not, it's turned down. By the time people see me, like, they just don't have an immune system that's protecting their gut. And then leaky gut, which we can see through something called zonulin. And so we can, those are actually the two most important tests that I like. And then just the balance of the bugs. And then of course, if there's a parasite and things like that. So those are some tests we do. I also look at liver and gut, liver health, because you need to be, your liver needs to create bile, and bile is part of that digestive process. So for me, liver is always part of the picture. So I'm going to look at the gut health, but I'm always going to look at the liver, and I'm always going to treat the liver in a gut health picture. And that
you have to. I mean, it's part of the digestive process.
And if
I love running a full stool analysis for that reason, because you see pancreatic enzymes, you see pancreas health, you see, like you said, inflammatory IgA markers, you see beta glucuronidase, which is a liver conjugation marker. And I'm always explaining to patients, like, well, that also has to do with, long-term ability to fight cancers and your ability to detox. So I love looking at poop.
I know. And I do have patients send me pictures all the time. I'm like, well, let me see what's going on in there. Because we analyze the stool through these tests. We analyze it through patients literally sending us the pictures of it. What goes out of your body is really important, and it's as important as what goes into your body, right? And so we need to look at that to really understand what's going on with your gut health. The other thing I love to look at is the tongue. Your tongue is the top of your gastrointestinal tract, basically. And essentially what the health of your tongue looks like really tells us a little bit about what the internal health of your gut looks like too. So if you have a cracked tongue, if you have a swollen tongue, if you have teeth marks on your tongue, if you have a coated tongue,
yeah,
all of those things mean something to us. So the coated tongue means that you probably have a dysbiosis, so that imbalance we keep talking about. The cracked tongue usually means to me that there could be leaky gut. Yeah. And then when there's scalloping of the tongue, which means there's teeth marks on your tongue and your tongue swollen, it means to me that either you're eating something you're intolerant to, or there's just inflammation
usually
overall. Yeah,
so much inflammation in the gut usually.
Yeah, so just look at your tongue, and actually I'll probably do a post about it, but look at your tongue, and your tongue can tell you so much about your gut health and where you need to be going. So that's one of the first things I do. What other kind of testing and what other things do you do for diagnosis, Dr. Livingston?
It's interesting that you mentioned that, you know, sometimes there aren't symptoms. So when I first started practicing, I would always think like, oh, they'll have a sign or a symptom that will kind of drive me to a differential diagnosis. But the more that I practice, I really just go right for the gut.
Yeah.
And it's just something that I'm passionate about. It's something that's helped me. It's helped so many patients of mine. So as far as diagnosis goes, as you said, even without a sign or a symptom, I typically will run some sort of stool analysis. And I did a post a long time ago as well on the one that I do. And I think we do similar tests, but just through a different lab. And you can gain so much information just from poop, you know? So that's one of the first things that I do. And I do ask for signs and symptoms. And now I'm a little bit, you know, many years into my practice, I'm a little bit more aware of the symptoms that can be gut health, but aren't really necessarily like something that you would think about. For example, skin, your other emunctories, your detox pathways, kidney function, brain fog, energy, sleep. Like these are all things that relate.
Literally every symptom can be related to your gut health.
Yeah.
And so, yeah,
basically I just talk to people and I'm like, oh yeah, we need to do a stool analysis.
Yeah. Yeah. And I think a stool analysis is helpful in almost everyone. So whether you have, you know, gut symptoms or not, as you were saying, because there's typically a dysbiosis, so that imbalance of the microbiome. And we can just see so much. We can see how good your immune system's working. And that's not just your immune system for gut health, but that's your immune system
whole body.
Overall. Yeah. So your gut is so important because a large portion of your immune system is actually in your gut. And then also, as we talked about in another live, you know, like
your
neurotransmitters are made there. So if you have headaches or if you have anxiety or depression or gut health is always something we look at. So, you know, I think there's like a joke, like, I mean, naturopaths, we're basically like gut doctors because we almost every naturopath is really treating gut health. That's really what we're doing. And that is the root cause of almost every chronic illness that we come across.
And to your point also about diagnosis and analyzing a patient, food sensitivities and allergies are, again, something that when I first graduated, I probably wasn't doing it on every patient. I was kind of, you know, feeling them out and taking their case. And now it's hands down one of the most beneficial diagnostic tools that I have, because if you're eating a food that you're either sensitive to or allergic to, and I use the Army analogy, which I'm probably not the best person to do that because I'm like Army, Navy, I don't really know, Marines. But I use that when I describe IgE and IgG and IgA sensitivities versus allergies. And if you're consuming something that you're allergic or sensitive to on a daily basis, you're number one, upregulating your immune system. And number two, you're creating inflammation in your gut. So that is one thing that every patient pretty much gets done with me now.
Yeah. Yeah. I agree. I also think for those who maybe don't have the, you know, the funds to do that or whatnot, I just have people take out all the inflammatory foods and then just reintroduce them back in. So that's another way of doing it. Someone's asking for recommendations you can practice at home. And Angie Jax, we actually talked about it at the beginning of this live. So I will post this on my page and you can watch the beginning. I think the other thing that you can do is something that we just talked about, which is avoiding all of the allergens. So doing an elimination diet can actually be really beneficial, where you just take out all those allergenic foods for 3 weeks and then you see if you feel better. and most people
Oh,
will
you're
feel
nice.
better.
I make them do it for like 8 weeks.
Okay. So 3 weeks, the reason I do it for 3 weeks is because those antibodies, they can start to fall down after 3 weeks. So even better to wait longer because a lot of those antibodies will stay alive for like 12 weeks. So
Yeah.
even better to wait longer. But 3 weeks is that minimum time that they need to do that elimination to see that there's a change. Once you see a change, you then reintroduce the foods back into your diet, and you'll do that one at a time. And the reintroduction for me is usually 3 days. And on day 1, you eat it twice. And on day 2 and day 3, you just observe if you have any symptoms. And the reason for that, right, Dr. Livingston, is because a lot of these intolerances have delayed reactions. So you might eat something today and then you don't experience something until 2 days later, which is why it's so hard to detect these. And you might be wondering, like, well, I saw my allergist. Nothing was tested. I wasn't allergic to anything. Well, your allergist is testing for something different antibodies, a different type of reaction. That's an allergic anaphylactic type of reaction they're usually searching for. And we're looking for these other antibodies. So they're usually IgGs or IgAs, and they can be actually delayed reactions. So that's why it can be really hard to figure that out. Easier to just test it, like Dr. Livingston said. But if you don't have the means or the funds, or you don't have a naturopathic doctor, you can also just do an
you can do an elimination for sure.
Yeah.
I do find that people tend to follow along with the elimination better when they see a test result.
Absolutely.
If you're really diligent about it.
So I always say, if you are the type of person that needs to see it on a test to take it out, we should do the test, because then you'll see it, you'll put it on your fridge, you'll know that you have to take it out. You're not going to be mad at me for taking it out, because it's your body that's saying that that you should take it out. And
your body told you, not me.
And it's just confirming that that's what you need to do. You know, and intolerance isn't the only thing we think about with food either. So there's so many other things we need to think about. So that's just one piece of the puzzle of what would be the correct diet for you. And with Dr. Livingston and I, we both would try to, you know, individualize that diet towards you, using things like the intolerance panel and also your stool test and other things too.
I often have to explain to people, well, you know, I recommended eliminating sugar or dairy or wheat, but you're not necessarily creating antibodies to that food. However, it ends up being a very inflammatory food, and look at your IgA or, you know, whatever zonulin, whatever marker we're looking at, you clearly have a gut health issue. So let's take out all the foods that trigger your immune system, and then also the foods that are just inflammatory in general.
Right. So there might not be
very fun, but
it might not show up on your intolerance panel, but for me, even if it shows up or not, I have everyone take out sugar, dairy, and gluten, and then we later see if you can bring it back in, you know, in a minimized way, because I just find that those 3 foods really cause problems in almost everyone. So if you have gut issues and you're consuming those foods still, I would try taking it out for 3 weeks and then see how you feel, and more than likely you're going to feel better.
And I often have patients say, like, well, don't you eat pizza or ice cream? And I don't have a sweet tooth, so no to some of that. But I have pizza on occasion, but I don't have a chronic health issue. So when we eliminate the health issue and we eliminate the cause, then on occasion, sure, you can indulge and you can live a life that's fun and, you know, go to Italy and have pizza. Also, their wheat is different.
I call it the 80-20 rule. I call it the 80-20 rule. 80% you're really following a really healthy anti-inflammatory type diet, and 20% of the time you're enjoying life. The other thing though is in Italy, the gluten there is different. So I've had patients who have bread in Italy and they're like, Dr. Fong, I had no problem.
I hear that all the time.
They literally hop on a plane, they get a croissant, like they had a croissant in Europe, they get a croissant at like Starbucks,
JFK.
and then all of a sudden they have gut symptoms. So unfortunately, in our country, some of the ways that our food is, you know, produced is not the best. So but I did want to talk about how we actually treat gut health. And so, you know, this is a common term in naturopathic medicine, the 4R program. And I think people use different R's for it.
Yeah.
But so
Yes, for
what
sure.
I tend to use is rid, restore, repair, replenish. So, but
I think
anyways,
we went to the same school.
right. So there's four things we try to do. And so Dr. Livingston, do you want to take on, maybe we'll kind of do every other. So you can take on rid.
Yeah,
So
sure.
what does rid mean when we treat the gut?
So when I talk to my patients about it, I like to garden. So I always talk about gardening, and I say we're getting rid of the weeds, right? Like we're in that seesaw of balance. We're getting rid of the bad guys that will imbalance your gut. I tend to use antimicrobial herbs. I don't have prescriptive authority here, nor would I really utilize it, even in cases like SIBO or C. diff. I tend to err on the side of herbal botanical medicine versus prescriptions. Nothing against them. They work as well. But you're ridding the body of the imbalance. You're getting rid of the bad guys. Goodbye, gone forever, if you can. And also part of that rid cycle, I've learned throughout the years to do some of the restoring, some of the gut healing, but not too much, because you really do want to focus on getting rid of the bad guys.
Mm-hmm.
But you also don't want to make too much inflammation happen. You want to be cognizant of the fact that immune system in the gut needs to be replenished. You need to focus on that as well, but it's a lot of like antimicrobial, antibiotic type herbs in that stage. I also do it with food, coconut oil, pumpkin seeds, garlic. There's so many things that you can just eat on a daily basis that keep that seesaw in check. But then also I do supplement with things that, again, will be based on that stool analysis and what I see in that. And I'll know what herbs to use based on what I see growing that shouldn't be there.
Yeah. And I do think those antimicrobial herbs actually, I personally think they work better than the medication. Yeah. And I think it's because of all the constituents that are in these herbs. So we will use an herb for the same herb that we maybe use for its antimicrobial properties. We'll use it for its blood sugar regulation properties, and et cetera, et cetera. And so when you're taking an herb, it's supporting you in so many different ways that is actually anti-inflammatory, that can be beneficial for the system, in addition to having that antimicrobial property. But when you take an antibiotic or an antifungal or an antiparasitic, it's literally only doing that one thing. Yeah. And there isn't there isn't this protective mechanism that I feel like our herbs have. It's almost like it was nature designed it to really, I don't know, to do the things it's supposed to do, but also support the system at the same time. So I find that using the herbs, it really is more nutritive as well as doing the killing as well too. So I really do like using the herbs, even if I have a choice, because where I practice, I have a choice that we could use the antimicrobial medications, but I like the herbs better, and I think they do a better job. I think
the rid phase is more than rid, I guess.
Yeah. And then I also put in that rid phase the diet too. So I say you have to rid your body of bad foods that you're putting into your system, and so we have to take that out too. Good. So then the next one is restore, and I think some people interpret these a little differently, but restore for me is restoring the gut function that might be missing right now. So you might want to take like digestive enzymes. You might need to take bile salts. Just if your liver is super congested, then we might just need to push that bile flow through so that you can create nice stools and get those toxins out of there. Maybe we need to give you some colostrum or some IgGs. We need to boost your immune system of your gut. So all
butyrate might be warranted.
Butyrate, these are basically prebiotics, things that feed the good bacteria. Those are all restore. So maybe your gut isn't doing those right now because it's so damaged. There's so much leakiness, which we can talk about in a little bit of what that is. But we actually, you can talk about that in repair. So, but then that we're restoring the function of what's missing. Now, the hope is once we're done with the whole gut healing, we don't need those things anymore. So
Right.
it's not my goal ever to keep someone on supplements so that they need
Yeah.
it for their function to be working. It's only while we're going through this 4-hour program. And then the hope is you don't need it anymore. Your gut's working great and you don't need supplements anymore. You're just eating healthy, eating whole foods, etc. So that's restore. And then the next one, Dr. Livingston, is repair. Do you want to tell us about that one?
Yeah. I love gut health. So to that point of repairing, I always tell my patients, you know, we talk a lot about poop, and I give them an analogy. So basically, from like your mouth to your butt, which no one really wants to talk about, but from your mouth to your butt, it should be a tube, right? Like nothing should go in or out except for what you put in it and what comes out of it. Unfortunately, when we have inflammation and we have injury in our GI tract, food proteins that should just be mouth to gut are going into the body, and they're wreaking havoc. They're creating inflammation. They're triggering the immune system. And so when we go in and heal the gut, we're repairing that, you know, mouth to butt process, and we're making sure that foods are not passing where they should not be. And so one of the things that I love, there's this one product that I just love that every naturopath knows about because it has so many things. It has glutamine, which is a healing amino acid. It has zinc carnosine, which is the form of zinc that feeds and fuels the immune system of the gut. It has mucilaginous herbs like aloe and marshmallow. They're healing and soothing to the gut. Like, it's just a great product, which, you know, you guys can message either Diane or Dr. Diane or I about. And that is something that I do in that phase. So I don't do it initially, especially if they have something like SIBO, because the polysaccharides in those herbs will actually feed some bacteria, but I'll do it later on when I'm trying to soothe and heal the GI tract. And yeah, there's so many things that you can do. I also have my patients do bone broths, and if they're vegan, I have them do vegetable broths. I have them eating foods that heal the gut lining. So
like okra.
Yeah, okra is great.
Yeah. And so, the term leaky gut, as you said, the mouth to butt thing. So when you think about the tube, and we think about basically the skin of the tube or the mucosa of the tube, those cells should be really tight. And so what Dr. Livingston said, when they leak, is that's because there's so much inflammation.
Like tight
there's so much inflammation that those cells now get what we call leaky. And so then those proteins leak through, and we need to repair that. So that supplement or those herbs you were talking about really help those mucosal cells to just tighten up, and those tight junctions can come back. And then the hope is you don't have these food intolerances anymore, right, Dr. Livingston? So the ones that we might have tested in the beginning, or those food intolerances or allergens that you had to take out in the beginning, once that mucosa is healed up, the hope is that you now no longer need to avoid those foods, and you can eat them all in moderation.
I usually say once or twice a week for something that was maybe a high sensitivity that we then, and it's really kind of amazing. You know, not everyone, like you said, has the means or financial means to run tests all the time, but when you run a test like that and you see a sensitivity, and then you do a gut healing protocol like the 4 R's, and then you run the test again, it's amazing to see the progress that your body makes and how it heals itself, and how you really don't have a sensitivity to that food. Not to say that you didn't before, you did, but the fact that you took it out and you did the work to heal, you're allowed to have it once or twice a week now, and then your whole entire health is different.
And I usually have them test it still, so if you get a reaction, you might not want to eat it at all, but most of the time you can now eat that food. So really good example was, for me, I used to be allergic to shrimp, like really allergic, and I would get like hives everywhere, and my breathing would change and all of that. And now, and it just amazes me every time, like I had shrimp yesterday, I had shrimp like 2 weeks ago, and it just amazes me that I can eat it now and I don't have any issues with it. So When you are healed and what I call true health, you don't need supplements, you don't need medications, you're just living life, eating whole foods, and your gut's working well and all that, you really should be able to tolerate these foods, everything on a moderate basis. So if I ate shrimp every single day, probably I would get leaky gut again. Because
and also your detox funnel would be full. Like you always use that analogy.
Yeah, exactly.
Be overwhelming your system.
Right. So I think everything in moderation is important once you're healed, and just eating a wide variety, beautiful colored foods all the time, lots of plants, etc. So that's repair. And then replenish is now that we've done all the good work and now your gut is hopefully healed and
mouth to butt.
Mouth to butt, and then your bad bugs are gone and you've restored the function and everything's moving really nicely. Now it's time to replenish your good bugs. And the problem is, I think a lot of people take probiotics before 1, 2, and 3 are done. Before those 3 R's are completed. And I think one of our professors, I remember him saying this, was good bugs will not want to live in an environment that's not happy.
I remember that too.
Yeah. And so I say that all the time. They're going to come through and they're going to be like, I don't want to live here. This doesn't look like a fun place. And so they just leave. Now, they might help as they're going through. So you might still feel better when you take probiotics, which you can take them. The goal is for those good bugs to inhabit your gut, really live there, hang out, and make a life there, and then help your digestive tract to work really well, right? That's the goal. And they won't do that in an unhappy environment. And so
on the flip side, the bad guys really, really like the unhappy environment.
Yeah, true. So you're just it's gonna help. So people say like, well, it really helps me when I take probiotics, Dr. Fong. Okay, great. But as soon as I stop taking them, I feel crappy again. And our goal is to replenish and then just be done with it. Like you're replenished, and now you don't need any of the R's. We've done all the R's, and now your gut's working well, and you don't need to take probiotics necessarily because you're eating probiotic-rich foods. You're eating those prebiotic-rich foods that we mentioned in the beginning. If you're just joining us now, just go to the beginning, and we talked about all those at the beginning. And
a lot of people don't know the difference of. You have to remember that the prebiotics feed the good guys, right?
Tell us a little more about that, because I don't actually think we talked a lot about that. So tell us about those prebiotic rich foods.
Yeah, so even if I don't run a stool analysis and I don't see a need for short chain fatty acids, I always remind people it's just all about fiber. So the fiber that you eat then fuels the good bacteria. It's almost like a feeding time for them when you eat good things. Versus when you eat sugar, you're fueling the bad bacteria. So having, okra, which is a mucilaginous vegetable, or having apples, which has both the pre and pro, the insoluble and the soluble, having basically a lot of fiber in your diet is what fuels the good bacteria. So just taking a probiotic, fine, great. But if you were just taking a probiotic and only eating sugar, it wouldn't have the same benefit as eating the food that fuels that good bacteria. Yeah. Like it needs something to sustain itself as well.
Yeah. Yeah. And I think so both are important. And I think that's great, because I don't think people know about this prebiotic idea that we need to give our probiotics, the good guys, fuel. And I think the feeding time is a really great analogy. Like when you go to a marine world or something, and it's feeding time, and they're feeding the whale, some fish.
Yeah,
it's the same thing. So I like that analogy. And so someone's asking, probiotics during pregnancy a good idea?
For sure.
Yes, that's a good idea. Absolutely. You're populating your gut. You're populating your everything, your vaginal flora and everything like that. And so, but the probiotic and prebiotic rich foods are equally important during that time. So not just the supplementation of the probiotics, but eating them in your diet. Somebody earlier asked.
It's funny because I typically avoid dairy, but when I was pregnant, I remember just like wanting to eat yogurt all the time. And you know, like I don't eat cow's milk ever. So I did, you know, non-dairy yogurts, but my body was craving those probiotics. When you're pregnant, you need to populate the GI tract and the vaginal flora for sure.
Yeah. Yeah. So really good idea. Someone asked about canker sores earlier and whether it's related to gut health. And
it can be.
Yeah, I've actually found that it can be that when someone is having frequent canker sores, one, I often see that when I'm detoxing somebody. So it can be a detox reaction, often when I'm detoxing someone. But when
the immune system being overwhelmed at that stage.
Absolutely. But I see when I see canker sores in people, I often ask about the gut health, and we often uncover things in the gut health. So I absolutely think that there are relations there with canker sores. And I think anything that shows up on the skin, on the mucosal surfaces, eczema, psoriasis, canker sores, all these things are often related to the liver, gallbladder, and the rest of your gut, which the liver and gallbladder I feel is part of your gastrointestinal system. So, so yes, absolutely. The person who asked that earlier, not sure if you're still here, but I just wrote it down. So that's the way we tackle gut health as naturopathic doctors. And as I said, we do so. And someone's saying, I've been detoxing for the past 2 weeks now and getting cancers. Yeah. So, sup, Joe, I definitely think that's a detox reaction. And it could mean, and someone else says, same here. It could mean that toxins are just really coming out, and someone else is saying same too. So a bunch of people are having that.
If they're more prone to an imbalance in amino acid consumption, things like lysine and arginine, etc., like that could be part of that detox pathway.
So you might want to improve your immune function. The other thing is, I think oil pulling might be really helpful. Oil pulling is where you take a tablespoon of oil, like sesame oil or coconut oil. I think coconut oil is probably a better choice because of its antifungal properties. And you'll just gargle with it.
I find a lot of people are actually sensitive to sesame oil.
Yeah, I do too. It's originally Ayurvedic, they use sesame oil, but I often tell people to just use, so the traditional way is with sesame oil, but I find that too. So I tell people coconut oil because there's also a lot of antimicrobial properties. And what that will do, it seems to me like toxins are trying to come out of your mouth. So it might be that you had, like, maybe you have an infection in your mouth. Maybe you have a root canal. Maybe you have amalgams. I'm paused. You're not paused, but I might be paused for you. So you might have toxins in your mouth that are actually trying to come out, Joe, and oil pulling might be a good option where you gargle with that oil for like 15 minutes. Those toxins will actually bind to the oil and then you spit it out. So you don't want to swallow that oil. You want to spit it out. Make sure to spit it out in your trash can, not in your
don't clog
drain, because it will clog your drain. That's happened to me. So make sure to do that. So that's one thing to do. And Joe, it might indicate that your detox funnel is not clear. If you want to know what the detox funnel is, I do teach a masterclass about my detox funnel every Monday at 5:30 Pacific Standard Time. And the link to that masterclass is on my profile. So I talk about the detox funnel. And so Joe, it might be that you're trying to detox and those toxins they just can't get out the body because your funnel's so full. And that's my analogy for how I describe it. And so instead of going through the funnel, out the stool, out the urine, it's going through the mucosal membranes in your mouth and maybe on your skin, et cetera, et cetera. So you can join the free masterclass if you want to learn more about that. All right, Dr. Livingston. So is there anything else to talk about this topic that you love so much and obviously
I'm so excited. Honestly, like we said before, not to like harp on it too much, but find a naturopath and run a really comprehensive stool analysis. It's a stool analysis and a food sensitivity and allergy panel. Like those three are the first line of defense when I have someone that has cancer, autoimmune disease, diarrhea, constipation, anything really. They're such useful diagnostic tools in the right hands of someone that knows how to analyze them and help you navigate that. I just want to impart that wisdom on everyone. Like, think about what you're putting in your body. Think about what's coming out of your body.
Yep. Absolutely. And on that note, both Dr. Livingston and I do virtual appointments. So,
Yeah.
even if you're not local to us, you can reach
And I
out.
just got my California license.
And I guess she's now practicing in California, but Dr. Livingston is right now also based in Connecticut.
Connecticut.
So
yeah.
Congratulations.
Thank
Yay.
you.
So I guess, if you guys can't find a local naturopathic doctor, then you can reach out to us. And Dr. Livingston, how can they reach you? Where can they find you?
So my website is rootsdeepmedicine.com, or you can just find me on Instagram. I try to post. I'm not great about it all the time, but I'm getting better. So
it's
yeah,
hard when we're also seeing patients and it takes time to make.
I have a 5-year-old. Yeah, reach out on any social media platform if you'd like, and we can either do a consult, or if you're in Connecticut or California, I can see you in person.
Okay. Great. All right. Well, it looks like there are no other questions coming in. Thank you, everyone,
Thank you guys
for asking questions. I think they were really great.
I want to do this one again. I really like this
stuff. Yeah, Dr. Livingston and I are definitely going to do this again. We have so much fun when we do this. So if you guys have any topics that you want us to cover, please reach out to one of us and let us know. And, we might try to do these every Monday. And so,
someone did ask about reflux. So maybe we should do a whole, we'll do a whole live on the digestive process and reflux and what that looks like and means.
Yeah, absolutely. We can talk about reflux, which is more of an upper digestive tract issue. So maybe we can do one on upper gastrointestinal. So great. And if you guys have any other topics that come, throughout the week, every Monday, we're going to choose a different topic to talk about. Hopefully, if we have enough, and I think we could talk all day. So every Friday I'll post, what our topic will be, and then we'll try to do these on Monday and just chat. And I think it's just really great. So, all right. Have a great week, everybody. Bye. Thanks for joining us.